Hi, my name is Mehron Kabeda. I'm from Ethiopia and I'm a pediatrician in my country. I've always had stomach issues, but once I joined uni, I was starting to have more symptoms, so I went to a doctor near me and I was first diagnosed with IBS, but then later on it was confirmed that it was Crohn's disease. And for the last 2 years, I've been on medication and trying to get better, but over time, I've lost more weight and the disease just got worse from there. So I needed to find a way to go abroad to find better treatments. So I searched on Google for gastroenterologist in Dubai and I was able to find a consultation, and I came here. He was really amazing. His approach is amazing. He takes his time listening to the symptoms that I was having for the last, I don't know how many years. We went through what was done for me there and then decided on what should be done here. So I was able to do some blood tests, CT scan was done and other examinations were done. And after that, since the findings were suggestive of the need for surgical management, we consulted again with Dr. Anranda. He was checking my mental status as he was telling me all the things, and because of that I was able to remain calm and take it one day at a time. And the day of surgery until I came out of the hospital, it was a really amazing treatment, from the security to the highest doctor that I was able to consult with. So the surgery went smoothly. There were no complications. I did not have any pain, and it was an amazing experience. The nurses were amazing in the ICU. They were amazing and they were helping me to walk around, to recover better. Because of that, I was really stable mentally and physically and spiritually. So after a 2-day stay in the ICU, I was transferred to the ward, and even the nurses in the ward were amazing. I was able to walk sooner than I expected. I was not dealing with any kind of pain. The only downside was having the tubes and all that, but even then, they were making sure I was mentally okay with everything, even the doctors, the nurses. The food was amazing. I did not expect that from a hospital. After discharge, my recovery is still going amazingly. Every tube that was inserted was removed today at the 10th day mark, and I'm so happy because of that. The overall experience was amazing and the recovery was faster than even me or the doctor expected.
Hi, I am Dr. M.Ch and I work here in Emirates Specialty Hospital as a consultant gastrointestinal surgeon, taking care for all the complex abdominal GI surgery. Here is a patient, this Mehron is from Ethiopia. She's a young lady and a pediatrician herself. She came up with an intestinal obstruction. And on investigation, we saw that the patient has lost almost 30 kilos in the last 6 months. And there was a very stricture, there's a narrowing at the small intestine, which was engulfing the colon, and also had a fistula with the gallbladder and the intestine. So all these things were because of a Crohn's disease. She had to be operated because there was no medications at this point of time which could address this fibrotic stricture and small intestinal obstruction. So what we did basically is that we did laparoscopically the whole operation, remove the gallbladder, address the fistula, remove the large intestine, small intestinal mass, address the colonic problem, address the bladder problem, and we finished. This is almost 5-hour surgery. The patient came to the ICU, recovered very fine, and started orally, and on the very first day started walking, and is basically out of the disease now. The whole lesion which was obstructing, the patient is very happy. She can eat well, she can thrive well. It's a remarkable surgery, not very commonly done because it's a complex one, and more importantly, it is done laparoscopically. In ESH, we have all the intricate setups and the manpower and the support system and the equipments, and hope for the best for Mehron, and we could achieve this. We are very happy.
So I would finally like to thank everyone in the hospital. Specifically, I want to thank Dr. Random, the ICU team in general, and the general manager as well. I want to thank everyone and thank you for the services.